I'm Michele Sullivan. Today I'm here speaking with Dr. Roger Lewis. He's an emergency physician at Harbor UCLA Medical Center, and he's been heavily involved in activities that have led to the creation of a new office under the National Institutes of Health, an office that's dedicated to linking researchers in emergency medicine with federal funding opportunities. Dr. Lewis, what's this all about?
Well, this is really a very large development for emergency medicine research. So previously, the NIH has had institutes and centers that have been structured around particular diseases or types of care or care providers. And in some cases, very important emergency medicine research has not found a natural home within that structure. So this office is created to address that issue and make sure that there's fair and thorough review of emergency care research proposals that have the potential for improving the care and outcomes of emergency department patients.
So you mentioned that some areas of emergency care research are somewhat like orphan projects that just have not found a home within the existing structure.
Right. So I think, first of all, it's important to point out that there are very important areas of emergency care research that have found natural homes within NIH. So, for example, the National Institute of Neurologic Disorders and Stroke has funded important emergency care research around stroke and head injury and related diseases. And the National Heart, Lung, and Blood Institute has funded important research around cardiopulmonary resuscitation and resuscitation from shock. So there are parts of emergency care research that have been fairly and appropriately funded and have led to important advances. On the other hand, there's emergency care research that either naturally falls between the existing institutes, such as research that would involve both resuscitation and neurologic injury, or especially research focused on the evaluation and treatment of patients before you actually know what disease they have, the diagnostic part of emergency medicine, which is such a large component. So that type of research has not naturally found a home within the existing structure. So one of the key activities that the new office will perform is creating opportunity by bringing researchers with good ideas together with program officers within the existing system that may be able to come together to lead to the funding of meritorious work.
The office does have an acting director, but I understand a permanent director has not been named to that yet.
That's correct. So right now the office is headed by Walter Koroshetz, who's the acting director and is a key leader from the NINDS, National Institute of Neurological Disorders and Stroke. And then also Alice Massetti from National Heart, Lung, and Blood is working to run the office. It is posted on the NIH website that they are going to begin or have begun a search for a permanent director who can really work to develop the activities of this office and make it as effective as possible.
How long will it be before emergency care researchers are able to reach out to this new office and make that connection?
That's a great question. The office was announced just very recently, and already they've provided contact information. So I believe that a highly motivated emergency care researcher with a good idea could contact them now and start to see what support the office could give in directing researchers towards appropriate resources within NIH.
And is there anything else that we should know about this?
Well, I think the most important take-home message is that this is the result of many, many years of work by people both within and outside of NIH. The efforts that led to the formation of this office began in 2006 with an Institute of Medicine report, was followed through by a very hard-working group from within NIH that studied NIH's funding of and evaluation of emergency care research. And it really demonstrates the commitment of people to come up with meaningful solutions to making sure that emergency care patients receive the best possible care in the future.
Thank you so much.